I'm Dr. James Bowers. I'm an orthopedic surgeon here at EmergeOrtho in Burlington. Robotic surgery, I reserve that for full knee replacement in certain situations, and for all situations I do it in partial knee replacement. The robot is incredibly accurate, and so you want to use it where you're going to have some issue with getting the proper alignment and positioning of the components. Certainly it's very helpful in a patient with a lot of deformity or issues, prior surgeries and that type of thing. Now with the partial knee replacement, I've been doing partial knee replacement with the robot since 2008. So it's something that has been around, it's changed companies over the years, but it's extremely accurate. I've had great results. I get a lot of questions about anterior hip replacement. I've had great success since 2008 using that technique. I think the biggest thing people need to understand, it's still a hip replacement, but it's done through a different approach or in a slightly different way. When I'm doing the hip replacement, I can actually see on the x-ray while I'm doing the surgery what's happening. I can check the x-ray, I can check the leg lengths, I can check the positioning of all the components, and it's all real time, so if I need to change something, I can change it right then and there. So that's a big difference. And the other big difference is I don't have to cut any muscle, I go between the muscle. The right candidate can go home the same day. A lot of times I'll keep them just one night, and that seems to work really well. Knee replacement, it is tough surgery, and I always tell people the most important thing about getting your range of motion is getting your range of motion before the surgery. So prehab or going to physical therapy before the surgery is critical. You have to get that knee moving, and if you do, you're going to do well. I always tell my patients, look, I'm going to do my part. I'm going to put in a great knee for you. It's going to be put in properly, but then you've got to do your part. And that's really kind of the hard part, because you have to stick with the therapy even when it's stiff and it's sore and you're struggling to get your movement. You have to stick with it and do the therapy. And that's the great thing about here in Burlington, we have fantastic physical therapists. I get nothing but rave reviews about what an amazing job they do. They really work hard. They've seen it all before, they're experienced, and if anything ever comes up, if they have a question, they just walk across the hall and they ask us. So it's really a good situation to be in. But yes, knee replacement, the recovery is going to be tough, but then usually after about 6 weeks, people are really getting around a lot better and starting to see that this is going to be a lot better than what they were dealing with before surgery. In the older population, maybe they have a chronically torn rotator cuff, or they have bad arthritis that they've been dealing with, injections aren't working, therapy's not working. Sometimes we consider doing actually a shoulder replacement. And that scares people, anytime you talk about a replacement, but you get to the point where you can't sleep, you can't function, you can't move your arm the way you need to. It's really an amazing operation. It definitely provides a huge benefit in their quality of life. Just with the new capabilities we have with the surgery, more people are candidates for it, and so there is hope for that person that's maybe really struggling with, they can't move their arm or they're having pain, it's hurting them constantly, it hurts at night. I think there are still, there's a lot of things we can do. In this over 40, over 50 population, a lot of times you think there's nothing that can be done. And I would say that's absolutely not true. There's all kinds of things that can be done, and that doesn't mean surgery. And so I tell my patients this all the time. Look, just because you're coming in here doesn't mean you're getting an operation. It means that you're going to get evaluated. You're going to find out why. My job, number one, is to provide a diagnosis. You need to know what is going on. Why am I hurting? That is number one. And number two is to provide options and education, and so that you can understand kind of what the next steps might be. And so those are really the two main things. And so if that'll get you to come in and get evaluated, it might be something as simple as an injection or some basic home exercises. It's amazing how often just getting an answer is peace of mind to know what's going on.